Well, thanks everyone for joining us today. We continue to get a lot of questions about our long haulers clinic and about long COVID in general. So we wanted to gather a team of experts today to answer some of these questions. So today with us, we have Dr. Jeanette Brown. She's an assistant professor of medicine in the pulmonary division, and she's the medical director of our COVID-19 long hauler clinic here at U of U Health. We have Dr. Kevin Shaw, who's an assistant professor of cardiovascular medicine at U of U Health. And we have Dr. Richard Orlandi, a professor of otolaryngology at U of U Health. So thanks everyone for joining us today. Media, if you have questions for our group, please put them in the chat. And unfortunately, we weren't able to get a Spanish speaking physician here in time today, so our apologies for that. So, okay, with that, Dr. Brown, I'm going to turn it over to you to give us an update on our long hauler clinic.
So we opened our comprehensive COVID clinic in July, the middle of July, and we've seen about 100 patients so far. We have about 300 patients going forward getting scheduled. And on average, I would say we're receiving about 10 referrals a day. Most of these patients are from the state of Utah, but we've had some from other surrounding states as well. And the most common symptoms that we're seeing are a lot of fatigue, post-exertional malaise, which is a term for if you exert yourself mentally or physically, then you have a lot of extra fatigue and discomfort hours to days after that exertion. And also commonly heart palpitations and abnormal sense of smell and taste.
Okay, thanks, Dr. Brown. And I wanted to kick it off. There was a study that was released earlier this week that indicates that if you are vaccinated, you are less likely to have long hauler symptoms. Do you want to comment on that briefly?
Yes, so I'm also an ICU physician, and so one of the major benefits of vaccination is that we don't see the more severe manifestations of COVID, so preventing hospitalization and being put on a ventilator. But this was intriguing as well because, up to 30% of patients who get COVID have these prolonged persistent symptoms. And this showed a significant reduction in the number of patients that were going on to become long haulers. I do know from the long hauler community that this particular study, though, the app that they used to collect the data was a little cumbersome to put all the symptoms in. So it might not be completely inclusive, but the protection that we're seeing from both severe disease and, becoming long haulers is an important reason to get vaccinated.
Okay, Dr. Orlandi, I'm going to ask you a couple questions. So one of the earliest red flags for COVID at the beginning of the pandemic was patients were losing their sense of taste and smell. We are hearing now that for some of these patients, their sense of taste and smell isn't returning. There's also, and I'm not going to say the name, I'm going to have you say the name of the condition. You and I worked on a blog together last week. Is it Fibrillation? I'm going to let you say.
Phantasmia?
Yeah, okay. It's a condition where people's sense of taste and smell returns. However, it's distorted and normal smells smell really terrible to people. So do you want to comment a little bit on those symptoms that we're seeing in patients and how long are these symptoms going to last? Will they ever clear up?
Thanks, Kathy. Yeah, just so let me be clear, I misspoke. Phantasmia is when you smell something that's not there. Parosmia is when you smell, you sniff roses, but they smell like rotting, food or something like that. And so that's something we also see. Yeah, the changes to the sense of smell were noted by my European colleagues in ENT pretty early on in kind of February, March of 2020. And it is a very early sign of when people begin to lose their sense of smell. It can precede some of the other symptoms that a patient might have with COVID. So it's one of those things we want to be really aware of. The virus does appear to attack directly the sense of smell, the nerves that conduct the sense of smell that are in the nose. And the problem with that is when those nerves are affected, they can die out and then regrow. And it's a little bit like pulling all of the wires out of a switchboard and trying to put them all back in. Sometimes those connections don't end up where they were originally. And so that's where roses can smell like rotting food, or gasoline can smell like lavender. It's just because the connections are all messed up. We do see sense of smell issues in a large number of people, as Dr. Brown said. 80% of people that have COVID tend to report this. And it does appear to last a long time in a small number of people. It can be permanent, or at least up to a year, as permanent as anything we know about COVID right now, in a small percentage of people. So many will recover, many will have full recovery, some will have partial recovery, but there's a significant number, anywhere from 5 to 10%, that can have a permanent loss of their sense of smell. Let me make one other comment. I keep talking about sense of smell, but as we've talked about, it's really sense of smell and taste. Much of what we perceive as taste is actually smell. And I won't go into all the anatomy, but we remember from kindergarten, sweet, salty, bitter, and so forth are on our tongue. But most of the herbs, the aromas, what you get out of a glass of wine is obviously much more than that, or eating a steak or whatever. And much of that is actually sense of smell. We perceive it as taste, but it's really smell. And so when we have a loss of sense of smell, we do lose our sense of taste quite a bit as well.
And we should point out, this sounds minor compared to maybe heart issues, which we're going to talk to Dr. Shaw about in a minute, but losing your sense of smell, that can be dangerous. Like you smell smoke, that's an alert, to get up and get out of your house or whatever. Yeah.
Yeah, no, you're right. And sense of smell, it's a, believe me, if you don't have it, you miss it. And it's a tremendous quality of life issue. But to your point, the ability to smell smoke, to smell natural gas, to smell rotting food, to smell any sort of other things going on is a safety issue as well. So we do have to work with patients when they lose their sense of smell permanently to factor those things into their lifestyle.
And I have heard it can lead to depression and things like that. And very quickly, Dr. Orlandi, we're hearing a lot about the smell therapy. So can you tell us a little bit about that? And do we think it's helping people?
Yes. So we call this smell retraining therapy. So we've been seeing patients with loss of sense of smell from head trauma, from other viral illnesses. This has been something that we've seen for quite some time, and a fair amount of work's been done. And the idea is you literally retrain your body and your sense of smell. So smelling something like, 5 different things: coffee, peanut butter, essential oils like lavender or something like that, and just doing it every day, once or twice a day, can help actually regain some of the sense of smell.
Okay, thanks. Dr. Shaw, I'm going to turn it over to you. So one of the more serious symptoms we're hearing about with long COVID are these heart problems. Can you talk to us a little bit about what kinds of cardiovascular symptoms you're seeing in patients who had COVID?
Sure. Thanks for the question. Thanks for having me. There's kind of a myriad of symptoms that Dr. Brown mentioned that a lot of these patients are suffering from after COVID-19. These range from things like chest pain, shortness of breath, palpitations, or sensation of a fast heartbeat, and lightheadedness. And when we see some of these patients, we do basic cardiovascular testing, so things like EKGs, ultrasounds of the hearts, sometimes invasive tests as well. And a percentage of patients, a small percentage of patients, we do find new cardiovascular issues. So these are things like pericarditis or inflammation of the heart sac, myocarditis, inflammation of the heart muscle. Sometimes we find things like congestive heart failure or weakening of the heart muscle. And one of the more common things we're starting to see is some form of what's called dysautonomia. In other words, the nerves that are responsible for taking care of actions that are involuntary In some patients, they're having a syndrome that's being identified more and more commonly called POTS, or Postural Orthostatic Tachycardia syndrome. It's essentially a hyper-exaggerated response to changes in position. And that's one of the more common things we're starting to see in patients that had COVID at some point. And that last syndrome it's a particularly difficult syndrome to manage, not life-threatening in any way, but very challenging from a quality of life standpoint.
Dr. Shaw, are people who already had heart issues more prone to these, or are you seeing them like as brand new symptoms in people who were otherwise healthy?
That's a good question. A lot of the patients that we've been seeing and I've been seeing otherwise healthy, in other words, did not have any known heart challenges or heart problems before this. And in some cases, there's a chance that maybe this syndrome sort of unmasked something that was not known of beforehand. But oftentimes we don't know because this is the first time they're having a lot of these non-specific symptoms. And through some testing, we'll learn that they do have a new arrhythmia or a new autonomic issue or a new heart muscle issue. And from there, we treat those just like any other patients that have those issues.
Okay, and I realize you're not a pediatrician, but can you talk briefly about the heart issues that we're seeing in children who have had COVID?
Yeah, it seems to be a slightly higher incidence in younger folks is this issue of myocarditis or myopericarditis, whether it's related to the initial infection or even related to vaccine, which I know is sort of a separate discussion point. That's one of this kind of hyper exaggerated inflammatory response. And in younger folks, there's a little bit higher incidence of this inflammation of the heart muscle that's being reported.
Okay, and one more quick question for you that we got in our chat here. Can atrial fibrillation be a side effect of COVID-19?
Yeah, it definitely can be. And again, how much of this was maybe pre-existing and not known about beforehand is hard to say. But that being said, some people, since they had their COVID infection, they have some of these symptoms: chest pain, shortness of breath, oftentimes palpitations. And we do often recommend heart monitors. So people go home and have remote monitoring of their heart rhythm. And we have found things like atrial fibrillation. So it is possible. What's the percentage that's happening? I think we're still understanding that.
Okay, thanks for that. Dr. Brown, I have a few questions for you, and some of these are similar. So we're having questions about, what we talked about. You touched on this earlier about symptoms in people who were vaccinated. So there's a question about people who suffer from asthma. If they're vaccinated, are they going to have the same level of difficulty as perhaps someone who wasn't vaccinated? And a similar question is, in someone who was vaccinated and still gets COVID, will these symptoms last as long? Do you want to tackle those for us?
Yeah, both are excellent questions. With asthma, there was some concern that there has been some data with people that were on steroids just prior to getting COVID, that they may have had more severe disease. But there are other times that we see, patients that are relatively asymptomatic or really mild disease that then become long haulers and have symptoms later. So it's unclear if it's just like a dysregulated immune response, in relationship to like when they actually got the disease and what their underlying immune system was doing. And then for the second question, can you repeat that again?
Yeah, the second question was just, another basic question about when someone's vaccinated versus unvaccinated, will their long COVID symptoms last as long? I don't know that we know the answer to that yet, but.
We don't know the answer to that. The recent Lancet study that came out, I think, went to 90 days afterwards. But there's also, because there's surveys, there's sort of a dropout percentage of people participating. So I think that's still an open question, but it's an excellent one.
Okay, and then another question for you, Dr. Brown. This smell therapy that we're talking about, is that something that people can find out more about at our long haulers clinic, or what do you recommend?
Yes, so, and I'm sure Dr. Alendi can speak to this as well. When we see patients in clinic, we ask them other questions as well to make sure there aren't coexisting conditions that may be complicating things like sinus disease or, seasonal allergies or something else going on as well, to make sure that we're not missing something, and not just saying everything is COVID. The flip side of that too, though, is to really spend time listening to our patients with the long hauler symptoms. I think a lot of them have felt less heard and less listened to in the past, and so that's something that we're particularly cognizant of when we see them as well.
Okay. And Dr. Orlandi, a person is asking a question here about, is it they've lost their sense of taste and smell, but there's only one smell that they can smell. It's hot dogs, they say. They're wondering if that's normal, where people who have lost their sense of taste and smell, but can just smell one thing. And is that a sign that perhaps their senses are returning?
Very interesting question. And I hope that for you, the sense of hot dog is a good smell and not a bad one. But the fact that there's any sense of smell early on does bode well later on for recovery. And so it may mean that, we'll have to see, right? That's the hard part. We usually see changes to the sense of smell returning at 6 months to 1 year at the latest. There are cases of much later than that, but they're very, very rare. Most people will regain some sense of smell by 6 months and then even a little bit more by 12. But the fact that there's any sense of smell now, even if it's just hot dogs, is a good sign.
Okay. And Dr. Brown, I'm going to go back to you for this. How do we know the difference between people who are having long hauler symptoms versus perhaps some other kind of health condition?
I think the key is, when we see patients in our clinic, is to do really thorough histories, review their medical records, and to keep an open mind. We've reviewed the literature for, the symptoms that are commonly reported by patients with post-COVID. But, for example, one of my colleagues caught a patient that just happened to have a gastrointestinal bleed was the reason for their fatigue and not, long COVID. So I think it's key for us as medical providers to make sure that we're not forgetting about other conditions that possibly could be manifesting as well. So a lot of it is the basics, listening to patients, taking a good history, asking a lot of questions, doing some testing if appropriate, and go from there.
Dr. Shaw, speaking of fatigue, a question for you. I know fatigue can sometimes also be linked to heart issues. Can you talk a little bit about that? If people who have had COVID are now feeling fatigued, when do we know that might possibly be linked to a heart situation?
That's a great question. Sometimes it is hard to tell. And like Dr. Brown mentioned, a lot of this has to do with taking a good history, really understanding what someone's activity level was like prior to their infection. Where were we starting before they feel this new sense of fatigue? And as I mentioned earlier, the sort of the depth of testing that we may or may not do is largely dependent on what we learn from our patients. Sometimes we'll do testing like ultrasounds of the heart or echocardiograms. Sometimes we'll put patients on treadmills. In other words, what's called a treadmill stress test, really to try to quantify how much a person is able to do in sort of in a formal pattern. And that's something that you can track over time. In other words, if you have a treadmill protocol and someone can run for 10 minutes on a treadmill, and if they're followed in an intensive rehab program and we repeat that test in 6 months, it can provide some reassurance to patients that 6 months ago I did 10 minutes on the treadmill in the cardiology office, and now I can do 15 minutes on the treadmill. So, fatigue is a tricky one because there are so many different organ systems that can potentially cause it. And from a heart perspective, we do some testing to try to figure out if it's related to the heart.
Dr. Brown, should people with long COVID who are unvaccinated, should they get vaccinated?
We're recommending that patients get vaccinated. Delta variant being more common in our population and, higher risk for transmission. The concern is that, we have seen cases of patient where their second illness with COVID is worse. I think the overall risks, make us, give us that recommendation that patients should get vaccinated.
And Dr. Orlandi, I know you oversee our vaccination program at U of U Health. Any thoughts you want to add to that about the importance of getting vaccinated?
I would agree. I think it's important to understand that the effects of the vaccine so far outweigh the risks. We do talk about the risks of myocarditis, for instance, with vaccination, but as Dr. Shaw mentioned, the risk of, there's also a risk of having that with COVID. And it's actually much, much higher risk with COVID. And so we want to balance all of those risks and benefits. And we do certainly recommend that vaccine. Even if you've had COVID, that natural immunity seems to fade, and getting a vaccine after a COVID experience does really boost the immune system so that you're not getting it again in the future. So we do encourage that.
So if we don't have any other questions, Dr. Brown, I'm going to throw it to you here for the end. If people do feel that they're having long-term symptoms, regardless of what they are, and maybe you could just also, rattle off a list of some of the things that you're seeing in the clinic, but how do they contact us? Can they go online and just make an appointment? Do they have to be referred by a doctor? What's the process for being seen for long COVID?
Yeah, so our comprehensive COVID clinic also does see patients who were hospitalized, who had more severe cases of COVID, and we see long hauler patient population. We have a website as part of the U of U Health website that includes the phone number. I don't have it off the top of my head, but we do ask for referrals that detail the symptoms that you're having, whether it's fatigue, brain fog, numbness, tingling, palpitations, lightheadedness. Like, just if people can detail what those symptoms are that they're having, it helps us, gather the appropriate records and get patients into the clinic appropriately.
Okay, and we did put the link to the clinic on our chat. So, any other final thoughts from our panel here today? Or any other final questions from the media or Facebook?
Kathy, I'll just add, this is something when we talk about long-term effects of COVID, let's talk about a disease that we're still just dealing with and still learning so much about, even the short-term effects. So we're going to learn more and more as time goes on. We are getting some early reports, as Dr. Brown and Dr. Shaw have talked about, with long-term effects. Last night, just in preparation, looked at the literature. There are over 1,100 publications on sense of smell and COVID loss, which is phenomenal when we think we've only been dealing with this for less than 2 years. We'll continue to learn more, and information may change. What we say today, we may learn more in the future, and we'll continue to be forthright with people as we learn that, and appreciate people who have had these problems helping us understand what's going on and communicating that information to us.
Dr. Shaw, Dr. Brown, any other final thoughts?
I couldn't agree more with Dr. Orlandi, and as was mentioned earlier, if you haven't been vaccinated, please get vaccinated.
Yeah, as part of our clinic as well, we're working with our researchers to help understand. I feel like the long haul population is very altruistic and not just wanting to help themselves, but other patients that might experience what they're experiencing. And then as part of our clinic efforts in the future, we'll help to educate other providers to, as our full mission of our clinic.
All right, so we're going to end it here. So thank you so much, Dr. Brown, Dr. Shaw, Dr. Orlandi. Thanks for being with us today and sharing your expertise. And if anyone else has any follow-up questions, don't hesitate to contact our PR team. Thanks, everybody.